Hi everyone, thank you for taking the time to watch this webinar on using the Csep Get Active Questionnaire. My name is Kirsten Lane and I was one of the members of the steering committee for the Csep Get Active Questionnaire, and I'm also sitting on the Csep CEP Technical Committee. I work at Camosun College in Victoria, BC, and I'm looking forward to sharing more about Ccep's newly released Get Active Questionnaire. So over the next hour, I'll talk you through how the Csep Get Active Questionnaire was developed, and then go through the specific document in terms of the layout of the first two pages and the purpose of the accompanying reference document. I'll then spend quite a bit of time talking about the pre-participation health screening process, specifically how the Csep Get Active Questionnaire fits within that process, and also a new tool that we have developed, the Csep CPT Health Screening Tool, and how it can be used with clients who have a medical condition to determine if in fact it is safe for them to proceed with someone with the CPT level. And finally, there are some case studies that we have at the end that integrate the knowledge about the pre-participation health screening process. A decision was made by the Csep Board of Directors in 2015 to develop an updated and rebranded physical activity readiness assessment tool. The goal of this new tool would be that it was user-friendly, grounded in evidence, and safely encouraged and screened in for regular, healthy physical activity. The development of the Csep Get Active Questionnaire was 2 years in the making. It started with a member survey to assess current practice with screening tools. We then had a strategic planning session with members of the Csep Get Active Questionnaire Steering Committee, and that included myself, Dr. Scott Thomas from the University of Toronto, and Dr. Phil Chillibeck from the University of Saskatchewan. Also at the strategic planning session were key Csep members and other experts and stakeholders involved in pre-screening documents. That led to the early version of the Get Active Questionnaire. It was sent back to members in another survey to assess their feedback on the design of the questionnaire, the questions that were asked, and the ease of its use. From there, we further refined the Get Active Questionnaire, and then it went out for 3 research validation studies with separate populations. One was older adults, another children, and the last was apparently healthy adults. That led to the final version of the Get Active Questionnaire, which you see in front of you. Throughout, the steering committee gave recommendations and revisions for further improvement of the document. So when I say there was 3, there was probably more towards 43 versions of the Get Active Questionnaire. But we are very proud of what was developed. Before I walk through the actual document, just a few notes about the Get Active Questionnaire and its use. It is designed to be a self-administered questionnaire. This means that a client who has access to the questionnaire through a doctor's office, a fitness center, or through some other provider may complete the questionnaire on their own, read the reference document, and make a decision themselves whether or not it's appropriate to begin a physical activity program. Or they might complete it in your presence as part of your pre-screening process and complete the form with your help. There are a few terms used throughout the Csep Get Active Questionnaire, and the choice of words was purposeful. We reference often an appropriate healthcare provider, and this is to recognize that depending on a person's location and the nature of their question, they may be going to their family physician, a drop-in clinic, to a nurse practitioner, or to a physiotherapist or some other appropriate healthcare provider given their medical condition or symptoms they may be experiencing. A qualified exercise professional, or a QEP, is defined as someone who has post-secondary education in exercise science and has an advanced certification in the area. So that is our Csep certified members. However, given some of the questions and the nature of the response, sometimes a CPT might choose to refer the client to a CEP given the complexity of the medical condition. All right, so I hope you have the Csep Get Active Questionnaire and the accompanying reference document out in front of you. As you can see, it's 2 separate documents. The first 2 pages are the Csep Get Active Questionnaire, and then the reference document is another 2-page document. If you're looking at page 1 of the Csep Get Active Questionnaire, you'll notice that there are a series of questions that identify clients who may need to seek advice from a healthcare provider or exercise professional before becoming more physically active. So there's a series of yes or no questions. If there is a yes response to any of these questions, the client is recommended to read the reference document before completing page 2 of the CSEP Get Active questionnaire. And I'll speaking more about what does it mean to have a yes answer to each of these questions later in the presentation. Page 2 includes something that I think is very novel amongst pre-screening questionnaires, and that is an assessment of the client's current physical activity levels. So it really gets at how many minutes per week a person is physically active. There is then some general advice for becoming more physically active, and finally a declaration that is to be signed before using this document with a certified member. If you now look at the reference document, you see the questions that were on page 1 of the Get Active questionnaire are now repeated. But this is to allow the client to make an informed decision about the appropriateness of physical activity or exercise. The advice may also direct the client to a healthcare provider or a qualified exercise professional for further information or clearance. So please take the time to read through the guidance that is given for each question that is asked on page 1 of the Get Active questionnaire. While the CSEP Get Active questionnaire is designed to be a self-administered tool, you may have a client fill out this questionnaire for the first time in your presence. So some quick instructions for its use. Obviously, we want clients to complete all of pages 1 and 2 of the CSEP Get Active questionnaire. If a client isn't sure of a response to a question, they should answer yes. If a client does answer yes to any of the questions on page 1 of the Get Active questionnaire, they should review the reference document. So if we use an example of a person who has asthma, they may answer yes to the question on shortness of breath at rest. That's question 1D on page 1 of the questionnaire. But then when they flip to the reference document, they read that if the shortness of breath is due to asthma and rescue medication controls the symptoms, then it is in fact safe for the client to do physical activity. So the client then may change their yes response to a no based on the information given in the reference document. As much as possible, if this is happening in front of you, you should have the client initial the form to note that they have made that change themselves. Once the form is completed, the declaration is to be signed, and we'll talk about the declaration in about 10 more minutes. And of course, if you haven't met your client before, ask them to bring this completed CSEP Get Active questionnaire to your first appointment. So next we're going to talk about the actual use of the CSEP Get Active questionnaire and how it fits with your overall pre-participation screening procedures. In preparation for the release of the CSEP Get Active questionnaire, CSEP has been busy developing the pre-participation screening procedures that you see on this slide. As you read through the 5 steps, you'll notice that it's really not different than what you would have done as part of your past practice. So step 1 is use some sort of evidence-informed tool, something like the CSEP Get Active questionnaire. And we'll talk more about how the CSEP Get Active questionnaire and a yes response fits within the screening process. Next is measurement of pre-exercise heart rate and blood pressure. I'll speak a little bit more about changes to these cutoffs, specifically for systolic and diastolic blood pressure at rest. Third, we want to confirm, even if a tool such as the CSEP Get Active questionnaire is used, what the client's medical history is. So do they have any suspected or diagnosed conditions? Are there any current symptoms associated with the condition? What medications, if any, are being taken? Have they had any surgeries? And all this information should be charted in your SOAP notes. Next, if a client does have a diagnosed medical condition, you need to be working within your scope of practice for your certification. And of course, you must have the knowledge, skills, and abilities to work with that client. Otherwise, refer as appropriate. And it's handy to have a list of people in your area who have expertise in different areas. And finally, as part of this procedure, Using the CSEP Get Active questionnaire, you can do a quick assessment of a client's current physical activity levels. And this can also help with step 4 when you're determining risk with exercise. In terms of the items and sequence that make up the overall pre-participation screening process, it really isn't different than what was identified in the first edition of the CSEP Physical Activity Training for Health Manual. And that is that you give your clients pre-assessment instructions, have them complete an informed consent, use a CSEP Get Active questionnaire or other evidence-informed tool to identify risk with physical activity, do observations to make sure they are well enough on that day to continue with a physical activity assessment, collect relevant medical history, and I'll speak more about this later, and take a pre-exercise heart rate and pre-exercise blood pressure measurement to make sure they are within limits. So just a few more notes about pre-exercise heart rate and blood pressure. The methods for measuring these two variables have not changed, but what has changed is the cutoff for the systolic and diastolic pre-exercise blood pressure readings. So heart rate is the same if a person has a pre-exercise heart rate of 100 beats per minute or greater, and this occurs over 2 separate occasions separated by at least 5 minutes. We would encourage this client to first seek their clearance from a physician. Now though, for systolic blood pressure and diastolic blood pressure, the limits are somewhat different. So a systolic blood pressure of 160 millimeters of mercury is a cutoff, as well as a diastolic blood pressure of 90 millimeters of mercury or greater. This change is based on research that was done by Scott Thomas and his group that was published in 2011. And in this work where they looked at the likelihood of an adverse event with exercise, it was noted that the risk was increased only when systolic and diastolic blood pressure went above the cutoffs that are noted on this slide. Some exciting news from CSEP is a project is underway looking at clinical practice guidelines for pregnancy. This means that the clearance process for pregnancy may be changing, so look for updates from CSEP over the next few years. So I know that you all know your own scope of practice for your certification, but we're just going to talk about this quickly because then you can think about how the use of the Get Active questionnaire fits within your certification. So if we look really briefly at what a CSEP CPT does, is that they work with apparently healthy individuals or those with one stable health condition who are able to exercise independently. Of course, even within that scope of practice, the CPT must have the knowledge, skills, and abilities to work with the specific medical condition, regardless if the condition is deemed to be stable. What does a stable or lower risk medical condition generally mean? Well, when a client presents and their condition is being medically managed and the client is asymptomatic, when they haven't had a change in their medication or treatment plan in the last 6 months, and if a physician has prescribed a medication, it is being taken as prescribed, then generally we feel that the benefits of exercise outweigh any potential risks. Some common conditions that are at lower risk for an adverse event during exercise include established hypertension when the resting blood pressure is less than 160 millimeters of mercury for systolic and 90 millimeter of mercury for diastolic. Type 2 diabetes when blood glucose levels are being effectively managed either by medication or by diet and lifestyle with no evidence of diabetic complications, or osteoarthritis when there's not currently excessive pain or inflammation. And I'm sure all of you can think of examples of people who may have one of these conditions who would truly benefit from increased physical activity, and being sedentary is probably the greater risk. The CSEP CEP has a broader scope of practice to reflect the 4 years of education and all the areas of exercise science knowledge that they've gained. So the CSEP CEP performs assessments, prescribes exercise, provides exercise supervision for those that are apparently healthy or those who have medical conditions, whether it's one or several medical conditions, functional limitations, or disabilities. So a CSEP CEP can work with clients who have higher risk medical conditions. And when we say higher risk, we mean that the client may have comorbid conditions, they may have symptoms associated with their medical condition, their treatment may have recently changed, or maybe the client's not able to exercise independently. And of course, the CSEP CEP must also have the knowledge, skills, and abilities to work with the client's specific medical condition or medical conditions. With higher risk medical conditions come a few extra considerations, and many CSEP CEPs who work with clients who have higher risk medical conditions are well aware of this. And this is because the benefits of exercise may not always outweigh potential risks unless certain precautions are taken. So to ensure safety during exercise, the CEP may have the client exercise within some prescribed limits, for example, limiting heart rate below a certain threshold to ensure safety, or use clinical monitoring like heart rate, blood pressure, or oxygen saturation, or some other physiological or psychological variable during exercise. Or the CSEP CEP may decide that they actually don't have the knowledge, skills, or abilities to provide specific exercise advice for that client. So instead, they refer the client to another CEP who has the knowledge, skills, and abilities, or perhaps to another healthcare provider for specific exercise advice. So considering the scope of practice for each of the CPT and the CEP designations, we'll now discuss how you should go about evaluating a yes response on the CSEP Get Active questionnaire. We're now going to start talking about clients who have a yes response to page 1 of the CSEP Get Active questionnaire. Remember, you might have clients who come to you with a completed form and they're coming specifically to ask your advice on what to do about a yes response. You also might have clients who are completing for the form for the first time in your presence. No matter what, your advice must be within the scope of practice of your certification and also align with your own knowledge, skills, and abilities. So if you feel that you're not confident in giving exercise advice to a person with heart disease, make sure you know of other CSEP certified members in your area who would be appropriate to refer this client to. So if you don't already do this, it's really important that you get in the habit, especially now with the introduction of the CSEP Get Active questionnaire, of charting any information you collect from your client in SOAP notes. SOAP stands for Subjective, Objective, Assessment, and Plan of Action. And remember that informed consent must be signed by the client prior to collecting personal information. The reason why your SOAP notes and charting information is so crucial is that if there is a situation where an adverse event occurs during exercise, you'll have documentation to support that you acted in a reasonably safe manner. And this is really important for legal reasons. If there's no written or electronic documentation, then you may be at risk for a malpractice lawsuit. So I'm now going to start talking about what to do if your client answers yes to any of the questions on page 1 of the Get Active questionnaire. And this may be even after they have read the reference document, they are coming to you for further advice. So question 1A pertains to a diagnosis or treatment for heart disease or stroke, or the experience of angina-like symptoms during activities of daily living. So the first thing you want to do is find out why the client answered yes to this question. You want to collect all the relevant medical history and absolutely chart it in your SOAP notes. So you should be asking questions anytime a person has a medical condition, such as what was the exact diagnosis, when was the condition diagnosed, have any medication been prescribed? If so, what medications have been prescribed and are they being taken as directed? You'd also want to ask if there's been any surgeries or other physician-prescribed therapies. Work by Scott Thomas and his group in 2011 indicated that there is a higher risk of an adverse event during exercise if a client has experienced these cardiac symptoms, such as the pain, discomfort, or pressure in the chest, shortness of breath, or nausea during a cardiac rehab program or during any type of exercise, if they've been diagnosed or suspected to have an aneurysm, valve disease, angina, acute myocardial infarction, active myocarditis, an arrhythmia of any sort, or heart failure, or if the client has not completed a supervised cardiac rehabilitation program. In fact, within Scott Thomas's paper, it states that the risk of prescribed exercise is highest for those who have not engaged in regular exercise and lowest for those who participate in supervised programs, whether they take place in a facility or based in the home or community, and this was level 2 evidence. So it is for this reason that we recommend that the CSEP CPT only work with clients who have completed a cardiac rehabilitation program and have completed that cardiac rehabilitation program free of any symptoms. You'll notice as we go through the questions on page 1 of the Get Active questionnaire that certain areas are highlighted in blue. And these highlighted blue areas are based on current research and pertain to the CSEP CPT health risk screening form that I'll discuss in just a few moments. So taking all this and kind of putting together, ultimately you need to use your professional judgment as to whether the client falls within the scope of practice. If you're working as a CSEP CPT, you want to make sure that the client does not have any of these characteristics listed on the slide. If you're a CSEP CEP, you need to have the knowledge, skills, and abilities to be able to work with clients who have higher risk medical conditions. Ultimately, no matter what level of certification you have, you should always be considering how the medical condition, the medications, and how any other treatment could possibly affect the response to exercise. And if you don't know the answer to that, then you don't have the knowledge, skills, and abilities to work with that client, and so you should refer instead to someone who does have that level of expertise. Question 1A also asks about angina-like symptoms. So if the client answers yes and says that they have had angina-like symptoms within the last 6 months, find out if this sensation is new for the client. If these feelings of angina are new, then the client should be speaking with their physician. They should tell their physician the nature of the pain, the discomfort or pressure, the frequency at which it occurs, and activities that might bring it on. If the client has been diagnosed with angina and the pain is not new, then the client should be working with a CSEP CEP who has the knowledge, skills, and abilities to work with clients with angina. A client with angina is not appropriate for the CSEP CPT level because there is a greater risk of an adverse event if precautions during exercise are not taken. Question 1B asks about a diagnosis of hypertension or a resting blood pressure in excess of 160/90. Again, you want to ask and probe the client with follow-up questions related to this yes answer. So if there was a diagnosis of hypertension, when did the diagnosis occur? If medications have been prescribed, what medications are being taken? If the client answered yes to this question because their resting blood pressure was not known, then you can certainly be using your pre-exercise blood pressure recorded as part of your pre-participation screening requirements. If the blood pressure is greater than 160/90 and you're working as a CSEP CPT, then you should refer the client to a CEP for exercise advice. Again, as was discussed earlier in this webinar, work by Scott Thomas and his colleagues in 2011 indicated that there is an increased risk of an adverse event during exercise if resting systolic blood pressure was above 160 millimeters of mercury and our resting diastolic blood pressure is greater than 90 millimeters of mercury. It is certainly possible that you might have some clients who do not have diagnosed hypertension, but on their visit with you have a systolic pressure greater than 140 but less than 160. If that's the case, then you should encourage these clients to go speak with their physician about this recent blood pressure reading. Their physician will likely do some follow-up measures and perhaps decide to intervene medically. You should also make sure you read through the reference document for this section for question 1B because it has some good information that might be helpful to the client. So physical activity is definitely a benefit to clients who've been diagnosed and been treated for blood pressure, but a really key part is that the client or you, the exercise professional, should communicate with the physician and let them know about the physical activity program that's underway. The physician may want to make some changes to medication needs based on the physical activity program. As well, clients who have resting blood pressures that are higher than the cutoffs, if working with an appropriate CEP who has the knowledge, skills, and abilities to work with higher risk hypertensive clients, they still can do exercise, but there might be some clinical monitoring that's needed, such as measuring blood pressure throughout the exercise session. Question 1C is about dizziness or lightheadedness during physical activity, and this one is simple. So if clients answer yes to having dizziness or lightheadedness, we recommend that they first speak to an appropriate healthcare provider to identify reasons for this dizziness or lightheadedness and minimize risk. Question 1D asks about shortness of breath at rest. And again, remember with questions 1A to 1F, this is referring to the last 6 months. So the reference document, again, is very helpful with this question and may give the client advice that they will have answered for themselves before coming to you, the CSEP certified member. If a client answered yes to this question because they have shortness of breath and it relates to asthma, if their shortness of breath is relieved with medication, then light to moderate physical activity is safe. If the client does not get relief from their rescue medication or has not been prescribed rescue medication, so they're getting shortness of breath and there's no medication that's been prescribed to help with that, then the client should consult an appropriate healthcare provider to identify reasons for the shortness of breath and minimize risk. So again, this is a question that does not have a clear step for proceeding. You have to use your professional judgment. You should chart the reason why the client answered yes. If you're a CSEP CPT and you chart that your client has a diagnosis of asthma and shortness of breath is relieved with medication, then it would be appropriate to proceed. However, if you find out from your client that they do not get relief from their rescue medication, or they really don't know why the shortness of breath has been occurring, then no matter what, this person should be speaking with their physician. Just a little bit more about the shortness of breath at rest. There was a paper done by Neil Eves in 2011 looking at the risk of adverse events in people who had respiratory disease. Specific to those with asthma, there was a greater risk of an adverse event during exercise if the client with asthma had experienced chest tightness, wheeze, shortness of breath, or cough on greater than 2 days per week, or experienced these same symptoms on more than 1 night per week. There was a higher risk if a client had to use rescue medication more than 2 times in the past 7 days. And there was a higher risk of an adverse event if the client had a respiratory condition other than asthma. So again, this is where it's important to find out about the shortness of breath. It is okay to work with clients with asthma if you're a CSEP CPT, but certainly you would want to make sure they're not experiencing symptoms as described on this slide. If so, then the CPT should refer these clients to a CEP or to their physician to understand further why they're experiencing symptoms or why their rescue medication might not be working. A CSEP CEP who has expertise in respiratory disease would be appropriate for the clients who have COPD. So use your professional judgment, make sure you chart all the information and show that you're working in a reasonably safe manner. And no matter if you're a CPT or CEP, refer as necessary. You need to be comfortable working with asthmatic clients in order to give appropriate exercise advice. So question 1E is loss of consciousness or fainting for any reason, and it's an easy recommendation. Clients who answer yes to this question should be speaking to an appropriate healthcare provider to identify reasons for the loss of consciousness and fainting and minimize risk. So finally, we'll look at concussion. This is the last of the symptoms that you look for as part of question 1. If the client is still experiencing symptoms related to the concussion, they should refrain from increasing physical activity. And if these symptoms are still occurring despite following advice from their healthcare provider, the client should be encouraged to go back to their healthcare provider. So again, making sure that you're always working within your scope of practice. Now it's time to move on to question 2. Question 2 asks about pain or swelling in any part of the body from an injury, an acute flare-up of arthritis, or back pain that could affect the person's ability to be physically active. Of course, if the client identifies that this swelling or pain is new, they should be encouraged to talk to an appropriate healthcare provider to identify reasons. So this might be a physician or a physiotherapist. Work by Phil Chillibeck and his group in 2011 indicated that there's a higher risk of an adverse event during exercise if a client with arthritis has experienced joint pain, severe stiffness, or swelling for greater than 2 weeks, especially if it's in the back, hip, knees, feet, or spine. There's also a higher risk of an adverse event if the client with arthritis has limited mobility in any activities due to joint damage. So again, if you're at the CPT level and your client has experienced joint pain or stiffness or swelling for greater than 2 weeks or has limited mobility, then this would be an indicator that the client is in fact at higher risk and should be referred to a CSEP CEP who has expertise in this area. It's not to say that the clients shouldn't exercise, but they might need to exercise with certain precautions in place. So again, you see the same statement. Make sure to use your professional judgment. You should know how the medical condition, any medications and or treatment, whether it's surgery, such as knee or hip replacement, how that affects the response to exercise. And you refer to someone appropriate whenever necessary. Question 3. So this is asking about people have been told by a healthcare provider to avoid or modify certain types of physical activity. This is a really tricky one to give specific advice for the CPT level. So medical history and understanding better why a person answered yes is crucial, and this information should be charted. So what should be avoided or modified? How should the activity be avoided or modified? Is this advice related to a medical condition? If so, what is the condition and how is it being treated? Are there any other precautions that should be followed to ensure a safe physical activity experience? The answers to this question could be quite diverse. A person might have been told by a physiotherapist to avoid certain movements with a joint. And so then you would chart this and make sure that within your exercise assessment and prescription, you too, as the exercise professional, are adhering to this advice. However, this could be more complex, and it might be that a client with angina has been told to avoid vigorous intensity exercise. This is where professional judgment is crucial. A person who answers yes because they have angina and have been limited in terms of how vigorous they do their exercise probably is not appropriate for the CSEP CPT level and should be referred to a CSEP CEP who has expertise in that area. And as always, you want to make sure that as part of this question, you're understanding if any medications have been prescribed, what treatment has occurred, if any, and how all of this affects the response to exercise. So this is one where you need to think about what your scope of practice is. Also think about your own knowledge, skills, and abilities, regardless if you're a CSEP CPT or CEP, and make sure that you have documented the healthcare provider's advice, and if you are proceeding, you're following that advice at each and every exercise session, whether it is supervised or unsupervised or part of an exercise assessment. So you might want to consider, if you're providing an exercise program that is unsupervised, of being very clear that the client should be following the advice from their healthcare provider, whether it be a physician or a physiotherapist. So last but not least is question 4 that asks if the client has another medical or physical condition that may affect their ability to be physically active. So this is one where right away their initial answer may determine whether you would refer the client to the CSEP CEP or another healthcare professional. So if a client answers that they have multiple health conditions, then they should be referred to an appropriate exercise professional or health professional. If the client just has one medical condition, then what is that condition? When was it diagnosed? If medications are prescribed, which medications have been prescribed? How do they affect the exercise response? I'll talk specifically to type 2 diabetes and osteoporosis on the next 2 slides because these ones are common amongst the Canadian population. So you really need to know what you know and make sure you work within your scope of practice as it relates to this question. So specific to clients with type 2 diabetes, exercise is beneficial in clients with diabetes. and the benefits of exercise outweigh many of the risks that could occur. So if the client has type 2 diabetes, you know the medical history that you should collect, and you know now that you need to chart this on your SOAP notes. Keep in mind that the Canadian Diabetes Association have very thorough clinical practice guidelines, and as it relates to physical activity, there is a higher risk of an adverse event during exercise if the type 2 diabetic client has a complication. So this might be complication affecting the vision, so the eyes, the kidneys, or the sensation in the toes or feet. There's a higher risk that they have comorbid conditions, but for the CSEP CPT, you can only work with clients who have one stable condition. But keep in mind this for the CEP level. There's also a higher risk of an adverse event if the client experiences shakiness, confusion, lightheadedness due to hypoglycemia. So find out more about the type 2 diabetes, and again, refer as necessary if you need to go to a higher level exercise professional such as the CSEP CEP, or maybe you just need to go to the client's physician to get more specific answers to these questions. So in terms of osteoporosis, work by Phil Chillibeck and his group indicated that there's a higher risk of an adverse event during exercise if the client has had a fragility fracture. So fragility fractures are ones that result due to minimal trauma. So you would not normally expect a fracture to occur, but because the client has osteoporotic bones, they sustain a fracture. So if a fragility fracture occurs at any time after the age of 40 years, this would be a higher risk. Another indicator in terms of risk is systemic corticosteroid use. So if a client has been taking systemic corticosteroids, things like prednisone, for greater than 3 months at a prednisone equivalent dose of 7.5 milligrams daily or higher, this again should be referred to a CSEP CEP or to another healthcare professional. If your client doesn't know the answer to the question about the corticosteroid use, then ask your client to phone the physician's office and find out if their dosage, or a pharmacist, and find out if the dosage would be considered greater than the limits given here. Another question to ask is about recent falls. So if a client has had a fall recently or more than 2 falls in the past 12 months, they are also at a greater risk of an adverse event. Certainly throughout this talk, when I say they're at a higher risk of an adverse event, it does not mean that they should not exercise, but again goes back to clients might need to work within certain limitations of exercise or constraints, or have more clinical monitoring. And that's where the CSEP CEP level would be more appropriate for these clients. All right, so now we've finished all the questions on page 1 of the Get Active questionnaire. So you should now flip it over and be looking at the top of page 2 of the CSEP Get Active questionnaire. And this question asks about clients' current physical activity levels. So it's basically getting at frequency per week and duration of each session to get an accumulation of the minutes per week the client is doing moderate to vigorous intensity aerobic physical activity. In terms of using this information, of course, you know, as a CSEP certified member, that we have our physical activity guidelines for adults and older adults. So if the client is doing less than what the guidelines recommend for the age group, we would want to try to encourage them to try to slowly and eventually meet the targets. There's also the 24-hour movement guidelines that were released in 2016 that are specific to children and youth. So you would use the respective guidelines to put this assessment and give the bigger picture to your client. Understanding clients' current physical activity levels also helps with the analysis of risk. So the cardiovascular risks associated with exercise lessen as individuals become more physically active. So it is less likely that an active type 2 diabetic will have a cardiovascular risk compared to an inactive diabetic patient. This also helps in terms of knowing how to proceed once you get through the exercise assessment into the exercise prescription. So clients who do regular physical activity, then you know that they can begin at a level of physical activity that is equivalent to what they're currently doing and progress as appropriate. And the CSEP Path Manual can help you with understanding how we should be developing an individualized and safe physical activity program. For clients who are inactive, so they're not doing the adequate amount of moderate to vigorous physical activity in the week, they should begin with light or moderate physical activity and progress gradually and as tolerated. And finally, it's good to also ask about the intensity of physical activity that the client wants to do when they start their physical activity program, assuming that they're ready to start doing a physical activity program. So clients who have a lower risk medical condition and are interested in vigorous activity, these clients should be referred to a CSEP CEP. So even though exercise is safe, there is an increased risk with more vigorous or near maximal intensity, and these clients would be better served by a CSEP CEP. So finally on page 2, after the general physical activity advice, is the declaration. And before you look at the declaration, just double check that all of page 1 is complete, and page 2, in terms of the assessment of current physical activity levels, has also been completed. Then check to see that the declaration has been signed and witnessed. In terms of proceeding, no matter what the client checks, specifically if they have yes and they choose the box, I've consulted a healthcare provider, or I'm comfortable being physically active on my own without consulting a healthcare provider or QEP, you still need to be working within your scope of practice. So if the healthcare provider has said that they should become more physically active, but you're a CPT who doesn't have expertise working with the client because they have osteoporosis, then you should refer them to another CPT who knows how to work with osteoporotic patients. Or if the client is higher risk because you learned that from the medical history that you chart, you should then refer them to the appropriate CEP. So just make sure that you are still working within your own certification and your own knowledge, skills, and abilities. For the last 40 minutes, I've been talking about the CSEP Get Active questionnaire and how it fits into your overall pre-screening process. One of the things that we recognized as we got closer to the release of the Get Active questionnaire was that we needed a tool to help assist our CSEP CPT members identify those clients with a medical condition who may be at greater risk due to certain characteristics of their medical condition. And so for that reason, we created the CSEP CPT Health Screening Tool. As discussed earlier in the presentation, as you go through your pre-participation screening procedures, you should be asking clients, regardless of answers to the CSEP Get Active questionnaire, if they have any diagnosed or suspected medical conditions. If a client identifies that they have a diagnosed medical condition, then the CSEP CPT Health Screening Tool can help you determine whether or not the client's medical condition is low risk. So again, when we talk about a lower risk medical condition, we generally mean that the condition is being medically managed. So the client is going to regular visits with the physician and following the recommendations made by the physician. The client is asymptomatic, that they haven't had a change in their medication or treatment plan in the last 6 months. And if a medication has been prescribed, then it's being taken as directed. And so the questions you'll see in the CSEP CPT Health Screening Tool help to identify those clients who are at lower versus higher risk. I just want to reiterate that this is not a substitute for the CSEP Get Active questionnaire or whichever evidence-informed pre-participation health screening tool that you use. So here's an example of the CSEP CPT Health Screening Tool. And for the purposes of this slide, I've just shown a shortened version of the tool. So if your client indicates that they have one of the medical conditions included on this tool, then you should ask the follow-up questions to ensure that they're not at higher risk for an adverse event. So for example, if your client tells you that they have asthma, ask your client, do they experience chest tightness, wheeze, shortness of breath, or cough on more than 2 days per week or more than 1 night per week? Also ask them if they've had to use their rescue medication more than 2 times in the last week. If you have to check either or both of those boxes, then that is an indicator to you that the client should either go to an appropriate healthcare provider for clearance or that the client should get exercise advice from a CSEP CEP. And of course, you would only work with clients with asthma if you yourself had the knowledge, skills, and abilities to work with clients who have asthma. We recognize that the CSEP CPT health screening tool is not comprehensive. Only 6 medical conditions were included on the form, and those were ones that were more common amongst the Canadian population. It is possible for the CSEP CPT to work with other lower risk medical conditions. However, the CPT should have had taken an appropriate continuing education course so that they know the proper pre-screening requirements for that medical condition. All right, well now it's time to take all the information discussed over the last 45 minutes and integrate it using several case studies. So I'll just give you a few seconds to read through this case study on Anne Ostilla, and then I'll highlight a few key points. All right, so Anne Ostilla completed a CSEP Get Active questionnaire as part of your pre-participation screening procedures, and as you review the form with her, she has answered yes to question 4 that asks, do you have a medical condition such as diabetes, cancer, and osteoporosis that may limit your ability to be active? She answered no to all other questions, and her physical activity level currently is 60 minutes per week. You measure her pre-exercise heart rate and blood pressure, and it's below the cutoffs identified earlier in this presentation. Well, she's come to you because she does have some questions about whether or not it's safe for her to exercise given her diagnosis of osteoporosis. So you ask her more questions about this diagnosis and learn that Anne was diagnosed 7 months ago. She has no other medical conditions. She has been prescribed Fosamax and takes it as directed. And she's been trying to make lifestyle changes. In fact, her doctor recommended that she speak to you about increasing her physical activity levels, specifically weight-bearing exercise. So is it safe for Anne to proceed? If you're a CSEP CEP who works with osteoporotic clients, you should be very comfortable proceeding without necessarily using this form. Of course, you would still chart all relevant medical history information on your SOAP notes so you have the appropriate documentation. However, we do recommend that CSEP CPTs use the health screening form to ensure their clients with osteoporosis or one of the other medical conditions are considered to be at lower risk. So let's assume you asked Anne about whether or not she had a fragility fracture, if she'd been prescribed systemic corticosteroids like prednisone, or if she had any recent falls or had more than 2 falls in the past 12 months. And she answered no to each of those questions. So you wouldn't have any check marks in the boxes because she answered no. Given that the CSEP CPT health screening form is based on current evidence and that Anne did not have any of the indications listed above, you can feel confident that her osteoporosis is of lower risk and she can proceed with an exercise assessment and exercise program. Before you begin, you should familiarize yourself with her medication, which was Fosamax in this case, and just make sure it doesn't affect the exercise response. Remember that the Get Active questionnaire assesses current physical activity, that was at the top of page 2, and she indicated that she's already doing 60 minutes per week of aerobic activity. However, you have yet to find out if she's incorporating resistance training or balance training into her program. So next we have Craig Corazon, and again, I'm going to give you some time to read through this case study. All right, so as you just read, Craig answered yes to question 1A on the CSEP Get Active questionnaire. He answered no to all other questions, and he indicated that his current physical activity level is 0 minutes per week. His heart rate and blood pressure are below the cutoffs. Given that he had a yes response to the question 1A, you know that you need to ask further questions. So you learn that he had some chest pain 7 months ago, he ended up having a stent inserted to relieve a blocked coronary artery, and now he's taking a statin and a beta blocker. He says he feels much better and does not experience chest pain at rest or with exertion. So, is it safe for Craig to proceed? So we know that Craig has established heart disease, but is it safe for him to embark on a physical activity program supervised by a C-SEP-C PT? So even though Craig's atherosclerosis has been successfully treated with a stent, and he's been taking medication since this time and is feeling much better, the fact that he's not completed a supervised cardiac rehabilitation program indicates that he should get his exercise advice from a C-SEP-C EP. And this goes back to information presented earlier in the webinar. Known contraindications for exercise participation include a diagnosis of angina, aneurysm, valve disease, etc. As well, work by Thomas et al. Indicated that clients with established heart disease could be potentially at a higher risk for an adverse event if they had one of the following indications. 1, they're not considered to be medically stable. They're currently inactive or experience cardiac symptoms at rest or with exertion. Their predicted VO2 max was less than or equal to 17.5 mils per kg per minute, or they were greater than 75 years of age. And I want to reiterate, it's not that we are saying that these clients should not exercise. Rather, we're saying that clients who have this sort of medical history should seek their exercise advice from people with more advanced training, such as a C-SEP-C EP who specializes in heart disease. So because of all of this information, you should recommend that Craig Corazon first take a clinically supervised cardiac rehabilitation program before proceeding with the C-SEP-C PT. So you could provide Craig with a list of programs in the area and make sure you follow up with him and check on his progress. Because if he proceeds with the supervised cardiac rehabilitation program and does so without symptoms, then he could be a potential client down the road. Last case study is about Irene Klingsfield, and she answered yes to question 1B on the CSEP Get Active questionnaire. I'll give you a few seconds to read more about Irene. All right, so although Irene answered yes to question 1B, she's answered no to all other questions, and her current physical activity level is 90 minutes per week. You can see her pre-exercise heart rate and blood pressure that are listed, and both are below the cutoffs. As you ask Irene more questions about her medical history, you find out she was diagnosed with hypertension 3 years ago and has been taking Altase ever since. You learn that Altase is an ACE inhibitor and she's taking it as directed. Her doctor is satisfied with her blood pressure and has recommended that she in fact increase her physical activity levels. So is it safe for Irene to proceed? So even though Irene has been diagnosed as being hypertensive, you want to make sure before she increases her physical activity levels that it's safe to do so. So given that her resting blood pressure was 146/78, you know that this is below the cutoffs listed on the C-SEP-CPT health screening form. Therefore, it is safe for her to proceed and increase her physical activity levels. Again, this is all based on work done by Scott Thomas et al. In 2011. Given that Irene's high blood pressure appears to be medically managed, stable, and lower risk, you should still familiarize yourself with the potential side effects of an ACE inhibitor and just make sure you understand how it could affect the exercise response. You can proceed with a moderate intensity exercise program because you have assessed her physical activity levels and learned that she's already doing 90 minutes per week of physical activity. Although this is below what is recommended in the Canadian Physical Activity Guidelines, she is starting from the point of doing somewhat regular physical activity program. As a prudent exercise professional, you should still periodically check on her blood pressure to make sure there's no change in her condition with her new exercise program. It would also be important to have Irene or yourself communicate with the physician to let the physician know that she is increasing her physical activity levels. The physician may also decide to monitor her blood pressure and perhaps make a change in her medication dose. As this webinar comes to a close, I just want to acknowledge the research that was used to inform the CSEP CPT health screening tool. And I'd also like to thank you for spending 55 minutes of your time learning about CSEP's Get Active questionnaire and our new CSEP CPT health screening tool. I hope you found the information informative.